This is the most fun time to talk is right after lunch. Everyone's going to either fall asleep or... Does anyone... who does notes on your EMR? Do you guys do the notes for your provider? So your physicians or your assistants that doing the notes for the physicians? Scribes, you're scribing. Who all scribes notes? Oh, this is going to be perfect. So your clinician hates doing the notes and you're just doing it for him.
Yes.
Good. This is going to be perfect for you then. Before we start, because we're not really starting here, how many have made your own templates? You've made your own templates. How many used the doctor's templates? You used the doctor's. How many thinks your doctor's templates suck? No, because if they're not efficient, if they're not quick, if there's no accelerators in there, who spends more than 3 minutes doing a note? Who does notes? Who does notes during the patient exam? Okay. Who does notes afterwards? Okay. Who would like to finish notes in every exam? Who has to leave it over wait till the end of the day to finish? You guys do it. You guys, so you do after each patient. Okay. You never wait. You know, you have enough time to finish during the patient encounter. You're not doing it he's talking, or the doctor's talking, and then you guys are doing the notes at the same time. Okay, good. This is going to be perfect for you. Okay, thank you. My name's Don. I forgot to put my name. You do slides and you forget your name. My name's Don Pelto. I'm going to talk a little bit about an EMR efficiency. Now, this is EMR agnostic, meaning you can use it with any EMR. I'm just going to show mine. Not that I'm not particular to mine. I want to show you how to be more efficient with your medical records, and I want to show you how to get home faster. Okay, and so this is going to be perfect for you and maybe for your provider. And you don't have to take notes. I'm going to put a QR code later on where you can get everything. You can just scan your phone and get all these slides. I'm the owner of Podiatry Practice Mastery, and I'm a paid rep for Athena, meaning when they want me to talk to a doctor, I talk to them and tell them what I hate or what I like about Athena, and they give me some money. I don't make a ton. It's just, I have to tell you. And I also am a practicing podiatrist that doesn't do my notes anymore. So I have a who, but a virtual who, which would be a virtual scribe that's with me all day long, except when I go to the bathroom, I turn them off. And sometimes I forget, which is kind of funny. It was a joke, sorry.
But don't say it hasn't happened.
It hasn't happened, right? So we're going to go over how to have staff prep your charts to save you time, how to use delegation to make your EMR work better, how to use templates efficiently, how to make orders quicker, how to simplify imaging documentation, and how to do a whole note for plantar fasciitis with night splint, prescriptions, everything in less than 3 minutes. Okay? That be helpful? I hope so. This is for you if you want to get home sooner, if you want to finish your notes in the treatment room, if you want to learn shortcuts and add-ons to make it work better, and if you're thinking about using a scribe, which I'm very happy that there are a lot of scribes here. So even if you're not a scribe for your physician, who is not a scribe here? Okay. And are you medical assistants?
I'm a scribe.
Okay. Okay, so I said who's not scribes? Who's not a scribe? There's a few that aren't scribes. I'm sure if you went to your physician and you say, hey, would you mind me scribing for you? They would just kiss you. Because none of us like to do our notes. We just have to do our notes. Okay? So stay to the end. So when you get the link, everything that has an underline has a direct link to a Google Drive folder with everything that you need. It's called a swipe and implement file. So everything, you can just steal everything, copy and paste. So let me explain how I got to these. We used MediNotes, okay? And then from MediNotes, we had to switch to a new EMR, Athena. And so I had to copy everything out of MediNotes, and I put them all in Google Drive, and then I had to paste them all into my new. That's why I just have them sitting in Google Drive. Not that I wouldn't do this for anyone else, except I did it for myself, and I'm letting you use it, okay? Okay, let's first start talking about chart prepping. Who currently preps charts? Okay, you prep charts. So before they come in, you do something to save you time later on. Okay, that's called chart prepping. The cool thing about chart prepping, in my medical record, what happens if they don't show up? If it chart prep, they don't show up, it deletes everything. That's what chart prep function is. So it deletes it's not going to show up. It's like if they don't show up, then it disappears. But chart prepping can save you a lot of time. Okay, this is how our medical record works. It has this chart prep tool. And so, for example, I double book everyone on my Friday morning, which is my routine day, and I just kind of put my head down and go. So I might see 30 patients in a half day. So they prep everyone. It's new from old, and it just gets everything. It makes it a lot easier for them. That's how my staff does it. That's one accelerator, is to chart prep. Okay, so you can do most of the note in there, and it's easier. Okay, any questions on chart prepping? No, that's easy. Okay. How many prep at the conclusion of the previous visit? Okay, so what I mean by that is you're being very explicit in the follow-up instructions. So I tell my scribe, I'm going to use the word scribe, okay? It could be whatever. And I say, okay, Mrs. Jones is going to come back in three weeks for a perinekia follow-up. That's easy. 3 weeks follow-up, they put all that in there. They're going to come in for 3 EPAT sessions a week apart with an ultrasound and my amnio at the second one. They type that in there. And we have a little thing so they don't make that many appointments. The scribe, they just write it out, in the person checking them out is going to put all those appointments in. Okay, patient has a wart, they're probably going to need 3 visits. You're going to schedule all 3 visits. So that's what we do. Or I'll put possible orthotic scanning, mostly just for a tickler for me, like possible orthotic scanning, possible shockwave, possible cariflex, possible onifix, and so they're going to type that stuff. So I verbalize that, and they type it in the billing tab. Okay, that's pretty easy. X-rays, 3 views of the foot next visit. That's how you prep before the next one. It just makes it a lot easier. Otherwise, you come back and you're like, well, what are we going to do? So you have to read the whole note. I don't know if but I don't have time to read the whole note. So what I do, and this might help your physician, is my guy's name is Murali, okay? And he's like, I couldn't live without him. I say, hey, Murali, like, what's going on here? What's next? And so he says, well, the next patient is here for a nail fungus follow-up. Their nail sample came back as negative for onychomycosis. So he just whispers that to me, and I go in and I see the patient. So he reviews the pathology. He'll review the ABI results. He said, Doc, the ABIs looked good. Okay, I'll go in, the ABIs look good. He preps me before I go in, because I see it's EPAP, but I'm like, is it right foot? Is it left foot? Is it heel? Where is it at? Until he tells me about that. Okay, so this is the way that you can help your physician as you're going in. Just whisper to the doctor, that's what they're there for. The nail sample was this and this. It just saves them time. Because I don't, so I have computers in every treatment room, okay? I have a desk with a computer, but my goal is to go from treatment room to treatment room with never opening the computer. And my rooms are really small, so like if you were there with me, like your part of your body would be right near me. So that's why I don't have they're super small. That's why we don't use a person. Okay, let's talk about delegation of work. Okay, so delegation of work. The front office, okay, I'm going to distinguish front office and back office. Okay, front office, they're going to add in all the billing, all the insurance, all the pharmacy information, their email, their cell phone. The back office is the medical assistants. They're going to add in the chief complaint, HPI, and review of systems. That's clear. You're already doing that, right? You're going in. You're doing that when you put the patient in the room, doing the blood pressure, stuff like that, and then you just stick around. So in my case, they do that, and then they leave and put the next patient in, and I'm seeing it with my scribe that's in my pocket. Now, one thing that we do with our EMR is they always take picture of the anatomy. So we have something called an Athena capture. I don't know if yours has something similar. So every wound, every ingrown toenail, every deformity, they're taking pictures of that to make it a lot easier for us. And frankly, I can't remember when I'm documenting. So like Murali's going to ask, was it right or left, medial, lateral border? I said, look at the picture. So they look at the picture, and that's how they can determine things. So it makes documentation at the end of the day. If I have to review or whatever, the picture, and also you can do I kind of take the pictures, and you can do social media cool stuff if they're ugly pictures and stuff like that. Makes it easier for completing notes. Now the scribe or the medical assistant is going to complete it in the treatment room. So he completes it with me, and they add in the physical exam, the assessment, the plan, the imaging, and the orders. So who does orders for your physicians? Okay. Who does x-ray reads for your physicians? Okay, why not? I'll teach you how to do it. You can do x-rays, you can read ultrasounds. So what I do is I pull up the x-rays in the treatment room and I say, decreased calcaneal inclination angle, there's accessory bone here, growth plates are open, fracture line transverse. And so as I'm saying it, they're typing it. And sometimes I'm in my treatment, I'm actually in my office. So like, let's say I'm sitting there drinking my coffee because my scribe makes me really efficient. So they say, the patient's in, they got 6 views, or ever seen 10 views, like 3 of the foot, 2 of the ankle bilaterally. And I go in and I say, okay, Morale, they got this, and then I go see the patient. So he's able to start working on that stuff, and then I can go see the patient. So I don't have to review it with the patient. I review it with the patient, but I use patient terms versus doctor terms. You know the difference? So like, he knows that, oh, your arch isn't that high. He knows that means decreased calcaneal inclination angle. Oh, there's a little fault in the foot. That's mid-column faulting. So he I use simple terms with the patient, but he can make them into doctor terms. So that's something key for you, because in the beginning, he was writing down like lay terms, and that didn't work that well. So you have to learn the doctory terms, okay? So if you click this link, you're going to get all my physical exam templates. So we'll talk about physical exam template. So who has one master template that you use for the physical exam? Okay, no one has a master template. What I mean by master template is it's a master template that has everything as vascular, dermatological, musculoskeletal, and neuro. Those are the 4 sections. If you make a master template, you could see every 99% of all the conditions with that one master template. And then you just activate what you need, meaning you just fill in the parts that you need, okay? So that's one way of doing it. You might have a master template. What I do is I do a master with add-ons, okay? So what I do, let me show you as an example, or what I made, and then my scribe uses it. So my master templates are right here. So CDFE normal, foot pain normal, ingrown normal, routine normal, paronychia follow-up, post-op normal. So these are like either follow-up or new, like really repetitive ones. You just want to have a template that really is quick, okay? And then add-ons, what I do is let's say I'm seeing someone for foot pain, but they also have nails and calluses. So the nails and calluses is only the nail and callus stuff that adds on to the foot pain. Or let's say they come in with a wound. It adds on a wound to the foot pain. Or it adds on a wart or a lesion to the foot pain. Does that make sense? So in my medical record, I pick foot pain, and it kind of, I can add things on. Now, when I pick them, this is the key. I add them in, not blank. I add them in with saved normal findings. Who adds, when you add a template, which one, does yours pull up saved normal findings? Yeah, it pull like DP pulses, bilateral palpable, everything else. It pulls in normal findings because you have to set that up in some EMRs. Like otherwise it'll be all blank and you have to click 500 times. So anything you're having to repeat more than 2 or 3 times, there's probably a way to make an accelerator to make it quicker, okay? So you guys can ask any questions you have at any time. Now, any questions about physical exam? Does that make sense? So if you want all mine, they're all right here on this link. Okay? So physical exam, you pull up the physical exam, pulls in normal findings, and then if they, by the way thing. Oh, by the way, I have a wart. Oh, gosh, I have to open up a whole nother. No, you just pull in the wart add-on or the wound add-on, and then you just fill it out, and it's templated. Okay? I'm sure you're all doing this. Okay. So here is I'm sorry, it's bad, but cardiovascular, skin, gait. So all my patients do gait evaluation. I say morale, the patient has pronation more on the right than the left, a right shoulder drop, and the forefoot abduction. He's putting all that into my gait evaluation. I'll say, your pulses look good. That means DPPT palpable. I'll say your skin looks fine, or there's some, you get some athlete's foot around the edge. He'll put in, dry vesicular tinea, or, for the tinea pedis, or put nails that are thickened. I say 1, 3, and 5 are thickened, and he'll put in the thickness there. Because in my case, he can't look. You can probably look and see and just put it, but I have to tell him. Plantar medial heel pain, equinus noted. I say this. You have a tight calf, and he puts in equinus, stuff like that. Neurological, Sims-Weinstein thing, and he knows what to put in. Questions about this? Anything that gives you frustration when you're doing physical exams? You just hate doing. Okay, that's easy. Good. Okay, procedures. So in this thing, I have, 127 procedures. So if you want all my procedures, you'll click that link. I have 127 procedures. What does that mean? Well, in my medical record, underneath the physical exam, I have all the procedures. But the cool thing is, the procedures in ours, I put in the procedure, and it links on the billing tab, so it pulls over all the billing information as well, so it makes it a lot easier. Okay, so the procedures, like trimming of non-dystrophic nails, nail debridement 1 to 5, keratoma 2 to 4, nail debridement, EPAT radial, EPAT combo, debridement of skin at the different levels. So all of these are in there. So if you're missing any procedures, you can just steal mine, okay? And then all of them have these options, like these are openings, like right, left, bilateral, what type of dressing. So all of mine have like option windows, like you probably EMRs have that where you can put in, we did betadine, we did what to dry, we're offloading with like a surgical shoe, a cast. So you can put in those options. I think that's important to make that before. So this is the skin debridement one. So making selected options, it's obvious, but that really makes it a lot easier for that. Any questions about procedures, anything that's difficult for you about procedures? You guys have them, okay. This is called procedure mapping. So in our EMR, we map the procedure. So we have all the procedures here and we have all the codes. It's more of a billing thing. So if you don't do this, what happens is you put in the procedure and you also, every time you go to the billing tab, my scribe does the billing for me as well. So you could help your doctor by putting in, it would automatically pull over the procedure, this procedure code, and you would just pick the right diagnosis of the diagnoses that you put in. Does everyone put in diagnoses for your doctors? Yeah, you're all putting in. So basically, you just match them up. It's pretty easy. So let's talk about now. So diagnosis. Try to use the most specific diagnosis for the condition. I know your doctor has probably told you you don't want to do unspecified. You want to do right. You want to do left. You want to do, is it tendinitis or is it posterior tibial tendinitis or peroneal tendinitis or tibialis anterior? I have a usage report that I included because I did a search when I was training him. I trained him on what I did 80% of the time, and the rest of it I just kind of taught him as we go. Orders. Do you all do X-ray orders, lab orders, DME orders, medication orders? You guys all do those, and so perfect. And then to make them easier, I gave you a list of all the different types of orders. So anything you do in order like more than once or twice, I think it's good to make an order template versus like, oh, I have to do it again, like anything, just makes it a lot easier. Discussions. This is what I think is one of the most challenging one. Is the discussion templates. Do you guys do a lot of free scribe typing? Or do you mostly use templates? Who does free scribe? Maybe you're being a transcriptionist for the doctor. Transcribing. How much of the note, this is mostly the discussion section, okay? How much of that are you typing up every time?
So we can take blurbs. So we always have our templates in our EMR,
yep.
Right?
Mm-hmm.
And I can cut and paste little bits that are, like the 5 steps for PF that we have generated,
yep.
right?
So you put that in there.
New PF patient, boom, counseling.
Yep,
So,
5 steps.
And then you can just go in and
cut and paste, delete certain things, and add. So it takes you no time hardly at all, or limited time. Okay. So is that the same? Anyone different than that? Does anyone sit there and type the whole time? Just the subjective. Mm-hmm. Perfect.
Or MSK.
Musculoskeletal. So musculoskeletal, do you have click boxes or no? You have to type that in.
We type that in.
Okay.
We have some set templates on MSK, but sometimes he'll either go, if it's a complex case, he'll go in and dictate it himself.
Okay.
Or he'll just, if it's pretty
MS.
plain.
So when you're telling me is you have a MSK and then it's a paragraph format. It's not like click format, like this. Okay.
No, it's a click.
It's a click.
So we use ECW.
Yep. Okay.
So, all I have to do is I've got one for every...
Yeah, everything you do. Okay, good.
Yeah, and I can just click and it'll pull it over.
Pull it in.
Click, pull it over.
Okay. But if it's really complex, they'll just okay.
And he'll have me notate things within MSK and then take out.
Good. Yep, that's the way I kind of do it too. Anyone different than that way? Okay. So I always say, whenever we write something repetitively, we want to make it a macro. We call it macros, whatever you want to call it. But I think that really makes it a lot more efficient. These are all the different orders we have. So we have X-rays, foot and ankle, ultrasound, or MRI orders. So in ours, we do an order and then we do a read. So I will show you how you can add in templates for the ultrasound and x-ray reads as well. These are the common labs, so if you don't have all these, you can add them. So what happens for ours is when I pull in like uric gout, or it automatically asks me to make a uric acid order, and then I can give my scribe privileges. I still sign off on it, but they can put those orders in. We have all the orders for physical therapy, podiatrist, interventional radiology, weight loss, vascular surgery, wound center, lymphedema center, all these things like that, bone stim. Do you guys do all the DME orders as well? So you're putting in, orthotics, night shoes, night splint, cam walker, AFO, ankle foot orthotics, surgical shoe, all those things like that, right? And then medications, you can put all the medications in as well. So they have the same 10 or 15 that they use, I think, all the time. We don't use a lot of different ones. So ours is a click-through for the x-ray. So does your doctor dictate the results, or is it a click-through? It's a click-through for x-rays?
Both.
Yeah, both. Yeah. So ours is click-through, and then there's a little box where I can write a few things. Yep, there's a little box. And then I do this, and it's very quick. Does the doctor tell you what they're seeing, and then you're doing it during the patient exam with the?
I would say sometimes we just
Just looking at the x-rays with them, what's there. So I think that's a really efficient way. We do selectable, and then if there's something else that I'm seeing, like I'll add it. Like if I, flattening of the second metatarsal, like Freeberg's infarction or something like that, I'll add it to the. You can tweak these and add them pretty quickly. So if you don't have one of these, you can steal mine. This is an ultrasound. So for ultrasounds, we examine the short and long axis with plantar fasciitis and all these normal thickening things. So they kind of put all that stuff in there that makes it a lot easier. Pathology reports, onychomycosis, it puts in the tinea pedis, puts in things like that, biopsy. DME orders. Okay, you guys put in the order. You have them probably sign the dispensing note, and you give them the proof of DME standards and all that stuff. That's what all the practices do, right? Okay. This is for a stretch fracture. Is everyone using fracture codes in your office? So you're all using fracture codes if there's a fracture that comes in. And then this is like for the cam boot. And then I also have here the way we do our DME in our standards right there. Okay. Assessment and plan. So these are the discussions. So if there's any discussions that you're looking, I have 960 discussions there. If you want to copy and paste, you don't need them all, but if I don't have one for a certain thing, you can just copy mine if that would be helpful. This is where I have my scribe spend most of the time. I recommend developing super discussions and then delete what you don't need. So let me explain. A super discussion is a discussion. Let's talk about one of the most common things we do is plantar fasciitis. So we have a super discussion in there that you just delete what you don't need. Okay, I'm going to go over that with you because that might help. So you just put that in there, and then it has everything. It has DME dispensing note. It has the reason they need a night splint. It's kind of everything in there. And so these are my discussions. So I want to give you an example as we're kind of about ready to finish up here. The plantar fasciitis, it takes 3 minutes. I want to kind of phrase it kind of how I do it, and then what my scribe does on top of that. So you guys have one computer in the room that you're using? Is it or an iPad or a tablet or something like that you're typing? Okay. The way I do it is I show a PowerPoint. It's called a patient presentation. So I do that on the computer that's in the room, and my scribe is using his computer virtually and filling things in. I do my discussion. So in this example, it puts in the discussion, the Aquinas discussion, the DME fitting portion of the note, the shoe recommendations, the orthotic recommendations. He does something for me called patient education as well, and I'll explain what you guys all do. Patient education for your doctors as well? You do? Okay. So for ours, there's different ways you can do paper. We don't do any paper in our office. We use something called Patient Education Genius. So what it is you upload videos, upload PDFs, upload anything that you want on this thing called Patient Education Genius. And Morali, he logs in and he sends it to Mrs. Jones. And it's cool because it pulls in their email and their cell phone into this thing. It's a website. And it sends them the patient education information, let's say about plantar fasciitis. So I have my new patient welcome packet, plantar fasciitis, which includes repeating everything I went over, but the cool thing is it can be sent via email or text message, and it documents it in the chart that they got it. So it kind of does everything, and it's kind of a neat add-on. Just a reminder, I don't know if you guys do this, but every time I do a medication, it's a level 4. I don't know if you're doing billing for your doctors as well, but usually it's a level 4 because it's considered medication management, just a tip. And then talk about medical complexity. So I'm going to go over a note. This is like one template. So it pulls in, Rob, this is a 56-year-old, or she's a 56-year-old female who presents today for evaluation of plantar fasciitis, okay? This template would have this in the beginning. It's the patient presents component. Then it talks about the physical exam, talks about the treatment options. And then the way I just do in my note, you can do it however you want, I kind of segment things to reduce inflammation, to reduce tightness, and to reduce stress through the foot. So in that note, it's talking about rest, ice, anti-inflammatories, cortisone injection, and possible shockwave. Tightness, it talks about deep tissue massage, physical therapy, night splint. And then under reducing stress, it talks about shoes, orthotic devices, and cam boot. Now, if I don't do some of those things, like a cam boot, I'll delete the cam boot, or he'll delete the cam boot stuff from it. Okay, that's the master note. Talks about shoes, and we put in, and there's a thing you can pick what type of shoe. It talks about orthotics. This is that patient education. And the neat thing is I put in here how long it took me to do that, how long it took me to go over a discussion with that patient of the information, the actual presentation I do. And then this here is these individual areas were discussed with the patient as well, okay? I also, most of my patients with that condition have equinus as well, so it pulls in the equinus template, what type, gastric soleal, right. We fitted them for a night splint, so it's the fitting component of the note that you have to have in the note as well. And then the new patient level of visit. This is a moderate level complexity. They're going to return in 2 weeks. So this is all in one template. And this is what I use to go over in my treatment room with the patients. It's kind of a little bit beyond the focus of this. This is just that fracture code we talked a little bit about. And these are all the resources I put in Google Docs. So if you want all of these, it has links to all these little templates and things like that. I also made, I'm like the king of repurposing. The reason is I had to train my scribe. So I made videos. And so, because I don't want to do it again. So I made videos, I did screen capture of how you do a plantar fasciitis note, how you do an ingrown note, how you do all these notes because it was a pain to do it. And I didn't want to train him twice, and I didn't want to train him live. So I recorded all these videos. So you can use, if you want to look at my videos, I talk about that. And so really the conclusion is set up your templates and simplify the process, delegate everything you can, consider a scribe. And here's where all everything is. You can either get it right here, podiatrypracticemaster.com/EMR, or you can do that little thing. Questions about scribing? We have 3 minutes. Any questions about that? Was that helpful? You guys know all this stuff? Was anything new? Yeah? A couple of things that were new? Okay. Good. Well, thank you. I'm glad you guys do this. Good job. Keep up the good work. We couldn't do our job without you. It makes it less sucky. So, does that thing work?
Oh yeah, I'm just not as tech savvy as.
And the internet here is really bad. So if you take a picture, you can type it in, because the internet here is really bad. Okay. No questions. Good. Thank you. It was fun.